Hi, I'm Susie, the practice manager from Surrey Total Health. Today we are going to discuss osteoporosis and particularly how to manage your condition during this current time with the coronavirus. Today I'm joined by Dr. Irani, our senior consultant rheumatologist, who has years of experience dealing and treating patients with osteoporosis. We are also joined by Mr. Unithan, our consultant orthopedic surgeon, and also Nisha De Cruz, who is our personal trainer as part of our wellness team, who also has years of experience with thousands of clients. Thank you, guys. So I'll just start by going to Dr. Irani. Could you start by telling us what osteoporosis is, please?
Hi, good morning. Yeah, osteoporosis is really little bone, less bone. It's porous bone. It has to be distinguished between osteoporosis and osteomalacia, which is just the bone is not calcified. It hasn't got hard yet. The calcium hasn't been deposited. That's completely different. And I think we need to distinguish that from osteoporosis, which is brittle bone. And so the bone breaks easily. Now, it's a growing problem. It's a hugely growing problem, and I'm sure Mr. Unithan will explain the figures further. But the thing is that we're getting older. Populations are surviving to an older age. Mm-hmm. We are unfortunately doing less exercise, and of course our diet is changing. So all three are lifestyle problems. The other thing is smoking. That's not good. Excessive alcohol is not good. So if you take more exercise, stop smoking, take less alcohol, and choose your parents, because a small skeleton means you've got less bone to, you can't afford to lose it, you see, if you're a tiny thing, as opposed to a sturdy person. So there are things that you can do, though, like exercise, and the simplest exercise is walking. And I often ask my patients one question, which is really missed from textbooks, and that is, do you have a dog? Because if you have a dog, you're obliged to go out walking with the blinking thing. So yeah, that's a good question to ask, a simple question to ask. So osteoporosis just means less bone, brittle bone, rather than anything else.
Thank you. And in terms of looking out for symptoms of osteoporosis, Dr. Irani, how do I know, or how do I get the idea that I may have osteoporosis? What symptoms do I have?
None, except one, which is the sinister one. It's a retrospective diagnosis. You look at, in hindsight, it's a fracture. When you fracture a bone, that means you've got to investigate it. And if you're in the age group of postmenopausal, you're slim build, you're a smoker or whatever, you take less exercise, then you're a dead ringer for osteoporosis. And so you would get any symptoms at all. Backache is not a symptom unless it's severe sudden onset back pain, where you have a collapsed vertebra, or indeed the most sinister one and the most common, frequently encountered, which I'm sure our orthopedic specialist will tell us, is fracture of the neck or femur.
Over to you, Nisha. Could you show us a few exercises that would help, particularly indoor exercises, I think are important for people to be looking at the moment whilst we're all indoors and in lockdown? Thank you.
Yeah, so I've chosen 4 exercises that together work all the major muscles in the body. We really want to focus on the muscles in the back, particularly the upper back, and around the hips, so the legs, glutes. And I'm using a resistance band for these exercises today, so that we can increase the load in the muscles. But equally, if you don't have a resistance band, you can still do these exercises. Body weight only does give us enough resistance to strengthen the muscles and therefore strengthen your bones and joints. These bands are really easy to get hold of. You can get them online for under 10 pounds.
Right.
So yeah, let's go ahead. Band is about 2 meters long. I'm going to step on it right in the middle. My feet are shoulder width apart. And I'm crossing the straps and bringing my hands to my hips. So already your postural muscles are all engaged, standing upright. So you come down into a squat, you hinge your hips back and extend your arms forward. Hold at the very end of the movement, so going as far as you can, and then slowly come back to the top. So think of every exercise as having 3 phases: an initial phase where you go down, a hold at the end at your full range, and then a return phase. So that's the first exercise. The second one, the band is going to be under my front foot, step to my back foot as far back as I can, keeping my heel lifted. And I'm going to hold the straps where there's some tension in the band. I'm going to keep my back heel lifted. I bend both knees and come down into a lunge, coming straight back up. You can add the arm movements or not. Again, the more muscles you engage, the more load there is, and the more benefit you get. The third exercise, we stay in the same lunge position. We're going to straighten the back leg and hinge forward at the hip. We're going to initiate the movement from the elbow, so really focusing on the upper back muscles, drawing the shoulder blades together and extending the arms with control. So holding at the very top of the movement will really help to load the muscle, build strength in the upper back, and extend. So the final exercise, I'm going to fold the band in half and hold my arms about shoulder width apart. This is where the band is really good because you can gently pull it apart to roll the shoulders back and engage the upper back muscles. Standing upright, keeping my shoulders pressed down. I'm going to take my arms up as far overhead as they can go. Hold without raising the shoulders, and then keep pulling the band apart as I lower the arms down. So you're aiming for about at least 10 repetitions, but then do what feels manageable. It's the time under tension that matters more than the number of repetitions themselves. So have a go.
Thank you, Nisha. Okay, Mr. Unithan, a question for you with regards to orthopedics and what problems do present themselves as far as osteoporosis is concerned?
So osteoporosis related fractures are a big part of any orthopedic surgeon's patient subsector. So majority of the fractures that occurs because of osteoporosis are wrist fractures, spine fractures, ankle fractures, and femur fractures. So femur fractures, and this is a femoral bone, and the majority of the fractures occurs around there. That is called the neck of femur fracture. Now, the surgical treatment is a big topic, but I'll focus on the neck of femur fracture, which is usually why elderly patients present to the hospital with a simple fall and have a fracture. That majority of the cases would require a surgical treatment. That would be either we have to fix it or give half a hip or a full hip replacement. These surgeries require a considerable amount of rehabilitation as far as the patients are concerned. So the best treatment is prevention, hence this topic about how to prevent osteoporosis. Now, Mike, before we finish, can I quickly ask you about the treatment of osteoporosis? Though it's a big topic, if we can touch base on it quickly, Mike, please.
Sure. First of all, treatment is prevention. That's the most important part of the treatment. And prevention is to do the things that we know seem to work. One is weight-bearing exercise. Swimming is not so good, amazingly enough, or cycling. It's weight-bearing exercise, and the simplest weight-bearing exercise is walking, frankly. So walking would be good exercise. Secondly, is to stop smoking. Smoking worsens bone health, and excessive alcohol. But the other thing is steroids, corticosteroids, prednisolone, and drugs like that, because people are taking for asthma or for bowel problems, etc., and they also weaken bone. So that, and the other factor is an early menopause. So if women who are more likely to get osteoporosis anyway have an early menopause, then they will get problems. Men also get early menopauses, and we check them for testosterone, whereas for women it's mainly estrogens that we check them for. So prevention is the most important, but weight-bearing exercise, etc. The other treatment is, as you say, calcium and vitamin D, which is very important, and vitamin D is free at the moment in the sense that you make it from sun, and we've got a lot of sunshine coming up into summer, so try and get as much sun as you can, except if you're fair-skinned, because you may get problems with the skin. So the recommendation is about half an hour to 1 hour at midday, and that's it. That's all that you need. You can take supplements as well, and there's some evidence to show that that helps, of course. But the other important thing is now with COVID, as it is, with a lockdown that we've got coming with us, we need to take exercise. Please do take exercise as long as you're protected, as long as you have a mask, or if you're going on, don't avoid public transport, of course, just walk, and you don't need to walk far. About an hour's walking would do you fine.
Thank you, Mike. Thank you.
Thank you. So thank you for joining us today. We are here to offer support with any questions that you have on this topic or any others. You can message us below on this, and you will also see, you can contact us on our website, which should be appearing on the screen now, or finally call us on 0800 160 1232. Thank you.
Thank you. Bye-bye.